Yeah, I think, in my training, I remember if you didn't have, compulsive behaviors with the intrusive thoughts, you didn't get diagnosed. And there were years of individuals that had profound intrusive thoughts that were very frightening to them and never got diagnosed. But now we understand some individuals are just have these intrusive thoughts. They're often not shared for many, many years.
Yeah.
And by assessing and aggressively treating those, it's tremendous relief for the kids and the family.
Welcome to Demystifying PANS and PANDAS, the podcast where we uncover the mysteries, breakthroughs, and hope behind these life-altering conditions. I'm Dr. Nancy O'Hara, a board-certified pediatrician, educator, and advocate with over 3 decades of experience helping children and families navigate the challenges of neurodevelopmental and neuropsychiatric conditions, especially PANS and PANDAS. These disorders can feel overwhelming, but here we'll break down the science, explore transformative treatments, and share stories of resilience and recovery. If you've ever wondered what's possible for your child or how to find answers, this is the place to start. Let's dive in. Hi, everybody. Dr. Nancy O'Hara, and I am thrilled to introduce you today, Dr. James Greenblatt. Jim is a globally recognized pioneer in functional and integrative psychiatry with over 30 years of experience, and he really has dedicated his career to transforming the treatment of mental health disorders through all kinds of precision-based approaches that integrate lab testing, nutritional interventions, and root cause analysis. He earned his medical degree and completed a psychiatry residence at George Washington, and then pursued a child and adolescent psychiatry fellowship at Johns Hopkins. No slacker. Dr. Greenblatt's also an incredible author, prolific. He's written 8 books, including Finally Focused, the Breakthrough Natural Treatment Plan for ADHD, which is a bestseller. And he serves as assistant clinical professor of psychiatry at Tufts and Dartmouth, and previously served as the chief medical officer for Walden Behavioral Care, a national mental health organization specializing in eating disorders. And then in 2019, Dr. Greenblatt founded Psychiatry Redefined, and that's a leading platform for continuing education for clinicians in functional and integrative psychiatry, and really designed to bridge the critical knowledge gaps for mental health professionals. His work has combined evidence-based research with decades of clinical experience in functional and integrative psychiatry to promote personalized precision medicine. And in 2024, he founded Mind Refined, a consumer education platform in functional and integrative approaches to mental health care. And it's really my honor to have Jim with us. I have personally known all of his efforts in combining this evidence-based research with his clinical experience. And I so appreciate you being here, Jim.
Glad to be with you, Nancy. Thank you for inviting me.
Yeah. So, my specialty in this podcast is demystifying PANS, PANDAS. And one of the things we see in those kids is a form of anorexia. And I know that is one of your areas of specialty. Can you just talk about it a little bit from your perspective?
Yeah, absolutely. So I've been working in the inpatient eating disorder world for 25 years. And when the association first started coming out that, PANS and PANDAS, restrictive eating and really severe presentations of eating disorders, it was very challenging to get my colleagues to even listen. And the early days and the tragedy, it's not too far off now in eating disorder programs, people still don't get the connection.
Yeah.
But so it was really frustrating initially. Some of the most challenging eating disorder patients we had were found to have PANS and PANDAS. So the association is clear in the PANS, PANDAS community. It has to be more integrated into the eating disorder community. And that's been a very frustrating part of my eating disorder world. But the treatment is similar, nutrition and refeeding, but without addressing the PANS and PANDAS, many of these patients have just suffered and lingered, and it's sad.
Yeah. And, we've talked that even when there is an infectious cause, it's not just about treating the infection either. It's not just about putting an antibiotic or an antimicrobial in. It's about treating the symptoms that are going on and in my opinion, treating the immune response, the immune intolerance also.
Yeah, I mean, as you know, and I'm sure as your listeners know, this is complicated. And when we add malnutrition, to Pans and Pandas presentation, it gets more complicated.
Yeah.
And, everyone kind of looks in their own little kind of silo and, okay, I'm going to treat the PANS with an antimicrobial. I'm going to treat the OCD with an SSRI. I'm going to put an NG tube in to help the malnutrition. And it's challenging to be able to integrate all those. And it's really, really important.
Yeah. Now, one of the things you've taught me so much about and written books about and lectured about extensively is lithium. And not lithium, the medication, but lithium orotate as a nutraceutical. And I know that's something that our listeners, viewers would really like to hear more about. So talk to us about that.
Sure. Well, that's an 8-hour lecture, so I'll try to cut it because it's really, been fascinating. I've been fascinated, since college, this mineral that's in the periodic table. So it is an essential mineral that we use it in all of our technology. So our cell phones, our airplanes, and our laptop batteries.
Yeah.
And on high doses, we use it as a medication. And many people are familiar with lithium carbonate to treat bipolar. My interest is that kind of in between zone of lithium as a nutraceutical. And the dosages people might be looking online about would be everything from 1 milligram to 30 milligrams of elemental lithium.
Yeah.
And I have found it really to be one of the most helpful adjuncts to my practice. I've shared with people, I've gotten the most thank yous, as I'm sure there are things where you get more thank yous with one intervention than the other because it resolves the symptoms. And so I think it's really important that practitioners and people understand that when we talk about nutritional lithium, we're talking about very low dosages. And I have found it particularly helpful in PANS kids. Again, lower dosages, the 1 to 2 milligrams. I think as people push it up, some people need 5, 10, or more, but I always recommend starting off at the lower dosages. The symptom that is most I think congruent with thinking about lithium would be irritability.
Yeah.
Our professionals might use the term mood lability, but I think we can often appreciate the grouchy, irritable individuals, and that sometimes can magically dissipate with nutritional lithium.
And do you test for lithium levels? Do you follow that at all? Do you think that's important?
I don't think it's critical.
Right.
I think the most important part I've learned over the years is family history. And I think that's often a neglected piece of the PANS Pandas world is doing a couple generation family history. And we often find OCD. And if we find addiction or bipolar disorder, those are the individuals that I have found most responsive to lithium, nutritional lithium.
Yeah.
So family histories of addiction or mood disorders. And the testing, it's not critical, but I do sometimes look at a trace mineral hair test, and you can, pick up levels of lithium, and some are undetectable. And those I might be a little more, comfortable prescribing the nutritional lithium.
Yeah. And you mentioned OCD. I mean, I think in addition to the irritability or the mood lability, those kids with OCD often do very, very well with low doses of lithium orotate.
Yes, I mean, lithium, again, the more you read about it, the more magical it becomes for me, but it does support, serotonin
Yeah.
and GABA, those calming neurotransmitters, and that can be very helpful for OCD.
Yeah. And with OCD, from either a medication or a nutraceutical perspective or a therapeutic perspective, what are the biggest things you see? Because that's one most of our kids with PANS Pandas deal with.
Yeah, it's really challenging. And the most important thing that I've learned and I relearn with every patient is that there's no one path.
Yeah.
I mean, so we can see, a PANDAS kid with no prior history developing a strep infection and getting OCD. And then we can see kids that have underlying OCD exacerbated by the infection. So this is where I think traditional psychiatry or maybe pediatrics have just not really scratched the surface because they don't have the ability to look deeper. And, we found everything from simple nutritional deficiencies exacerbating OCD, like a vitamin D level that's
Yeah.
very low, to more complicated gut problems. So there's not one path to OCD, usually a little genetic vulnerability, but there are many paths. And it is a really an area that functional medicine, functional psychiatry can do a really big service by helping parents.
Yeah, absolutely. And with the OCD also, I think it's important for families to understand it's not just about the hoarding or the light switches, or one of the biggest and insidious ones is the intrusive thoughts. Yes?
Yeah, I think, in my training, I remember if you didn't have, compulsive behaviors with the intrusive thoughts, you didn't get diagnosed. And there were years of individuals that had profound intrusive thoughts that were very frightening to them and never got diagnosed. But now we understand some individuals are just have these intrusive thoughts. They're often not shared for many, many years.
Yeah.
And by assessing and aggressively treating those, it's tremendous relief for the kids and the family.
Yeah, yeah. And therapeutically, besides the nutraceuticals, therapeutically, do you feel that cognitive behavioral therapy, DBT, others are really important, or other forms of therapy that you recommend?
I think, again, with OCD, particularly with a PANDAS picture, you have to kind of address, all the legs on the stool.
Yeah.
I think that the cognitive behavioral therapy is critical. But in my world, they've tried that for 2 years, and we find out they have a vitamin D level of 5, which is very low.
Yeah,
And vitamin D is required to make serotonin, and we know there's a connection. So it's really kind of looking at a more holistic picture, but it's hard to get the relief you need without the behavioral interventions, without the nutritional interventions, and sometimes, the infectious underlying cause.
yeah, yeah. And like you said, it's at least a three-pronged approach, but addressing all of those is essential. I find sometimes families, in paying for everything they're doing nutraceutically, abandon the therapy. And I think, like you said, every child, when we know one child with OCD or one child with PANS, we know one child. And it needs to be individualized, but it also needs to be comprehensive in our approach.
Absolutely.
Yeah. Now, one other that I've heard you talk about a lot and that I think is fascinating is cholesterol. And I'd just like you to talk about cholesterol and mental health a little bit for our listeners.
Sure. I mean, I think from the 50s, but certainly, in the 60s, we kind of associated this cholesterol level as the evil of all mankind. And I think that I'm not a cardiologist, but I think we can say that been disproven in terms of the cause of cardiac problems. So this demonization of cholesterol has really been a disservice to my field, psychiatry and mental health,
Yeah.
because one, medications that lower cholesterol can result in depression and cognitive decline if not monitored. But there's a likely genetic vulnerability to something that I just call very low cholesterol. And if people know cholesterol numbers, I'm sure they've checked their own. These are total cholesterol numbers under 120 and unrelated to dietary intake. So most of the kids I'm seeing would be eating standard American diet and having hamburgers and plenty of cholesterol, but they are more vulnerable to major psychiatric illness like depression, addiction, and the most dramatic being suicide risk. And it's very frustrating because there's at least 30 years of research, hundreds of articles showing the same conclusion, but it just doesn't get integrated into clinical practice and it doesn't get taught to our doctors in training.
Yeah. And we see it a lot in our kids with autism,
Yeah.
particularly our young people with autism. And we see great improvements in speech, communication, thinking when raising their cholesterol levels. Now, certainly we can do it through diet, but what about nutraceuticals for raising cholesterol?
Sure. I mean, I think they're not, consistent programs, but I've just found because I actually first started, learning about low cholesterol as a child psychiatrist with the autistic kids, as you did. Then we started seeing it, in young adults, 18 to 25-year-olds, and then I realized there was a literature. So my approach is one, dietary. It's okay to eat the eggs, digestive enzymes, bile acids, and helping digest the fat that's available. And then cholesterol supplements. I have used those for many years, and it doesn't always push the numbers up too high, but most people feel better. I mean, some of the significant, at least the depression, the agitated depression and suicidality, I've seen lift, even though we might have only bumped the number up to 10 or 20 points.
Yeah. Yeah. And it really is something that I think has gotten a bad rap over the years, and something we have mistakenly seen as a negative, high cholesterols. And I think a lot of these kids do much better with a slightly high cholesterol.
Absolutely. It's
Yeah. Now, I first learned about you or read, the first book I read that you wrote was that Finally Focused. And can you talk just a little bit about your natural treatment plan for ADHD? And it's in the book, but certainly just a brief synopsis.
Sure. I mean, I came out of medical school, a child psychiatrist, and you open up a shingle and all you see is ADHD. And, just, didn't tired of prescribing Ritalin and started looking a little more closely and realized not only was there a literature, but patients were getting better from other nutritional interventions. And so I've been doing this since 1990. And I remember my first talk to the public was 1993. I returned to Boston, and everything I said, from sugar sweetened beverages to magnesium to zinc, there was no research to support it. I was just talking about clinical experience. And I remember having to say that there's no evidence that sugar affects behavior because the Pediatric Association at the time did the big study, or red or dyes or additives. So that was 1993. So I waited till 2017 to write the book of the way I've been practicing. And it just looks at all these, I call it the plus minus plan, a way for parents to appreciate there might be things that you need to add into their diet. And that's usually protein and micronutrients, zinc and magnesium and omega-3s being the most common. And then the minus is there are things that interfere, and like high copper, like lead, like maybe gut dysbiosis, yeast, was certainly common when I started because pediatricians were putting everyone on antibiotics.
Yeah.
So it was just a kind of summary of my 25 years of practice looking at how we can address ADHD as a neurobiological problem. It's not a parental problem. It's not a pediatric problem. It's neurobiological, and just giving these kids, a chance, because not treating the ADHD, it is horrific. These kids suffer. And it doesn't mean medicines might not be needed, but I think if parents can appreciate looking at things more naturally, kids just do better. And if they do need medicines, medicines work better.
Yeah. I was teaching kids with autism in the early 80s, and that's when I first learned about the Feingold diet and was able to see firsthand the problems with the sugars, the dyes, the salicylates, et cetera. But it wasn't recognized outside of that community at that time. And then fast forward, God, in the early, well, it was about 1999, I had left my conventional practice, and I had a young man who had ADHD, and I was about to put him on a stimulant medication. And then I started my functional medicine practice, and I took my first diet history. I hadn't done that in my conventional practice, and he was eating 9 bananas a day. And he ended up having a phenylsulfotransferase deficiency. We took the bananas away, and all of a sudden he didn't have ADHD. I mean, it was really an eye opener for me. And the teacher and the therapist were just so happy I had put him on the stimulant. And, it wasn't until about a month later that we said, no, we just changed his diet. So,
Yeah, with young kids, I don't know if you remember Doris Rapp,
yeah,
seeing her on TV talking about food allergies affecting behavior. So early on in my practice, doing food allergy testing made a dramatic difference, particularly in the kids that got kicked out of preschool, these under 6-year-old
yeah,
kids, which I do worry about now that our colleagues are putting on too many supplements rather than just removing foods. But food allergies, particularly in the young kids, are such a significant factor in many with ADHD.
yeah. And often, just by taking a good diet history, you can see because often kids crave that which they're most sensitive to. Doesn't take a lot of testing. Families can be detectives and start to figure this out.
Well, one of my favorite stories is where the mother came in with a sibling with the Hawaiian punch, the big, big thing of Hawaiian punch. And I was talking to the mother and one child, and this kid drinking the Hawaiian punch was running around the waiting room uncontrollable after drinking the Hawaiian punch.
Yep. Yep. So common. But the AAP and others are coming around. We're finally saying red dye isn't any good. So,
It
baby
took a
steps.
while, right?
But you and I have both seen such a staggering increase in mental illness. I think even more in the last few years. And one of the things I heard you say on another podcast or interview was you never hear about cure when we talk about mental illness. And I found that whole conversation fascinating. Can you talk about that sort of paradigm a little bit more?
Yeah, I mean, two words you don't hear in psychiatry or mental illness is prevention
Yeah.
or cure. But in other fields of medicine, we talk about preventing a heart attack and we're talking about reversing, if you have cancer, we're going to put you in remission. And in psychiatry, everything has to do with just symptomatic based care. So we have a list of symptoms. You're depressed, you're anxious, you have mood swings. We're going to call you a name, and then we're just going to give you a drug to treat the symptoms. So there's no path to looking at underlying cause. And it's such a disservice, certainly to patients, but to parents. The polypharmacy now in our children is just frightening because as kids are struggling, my colleagues are trying to help, and all they know is to add another medicine.
Yeah.
So it used to be rarely would we add a second medicine. And now kids are coming out of hospitals with 5 psychiatric medications.
Yeah.
So I just think we've struggled in psychiatry for thousands of years, certainly the last 100 years, and every 25 years we have a different kind of model, but it's all symptom based.
Yeah.
And I think this is where your work and my work with looking at functional medicine can really make a dent and move many of these kids around.
Yeah, absolutely. Why, just from your perspective, Jim, why do you think there's not more understanding of pushing for looking at root cause of illness and rather, as my mentor always called it, the name it, blame it, tame it medicine. We name it ADHD or anxiety and we tame it with a medication. We blame everything on that. Why do you think root cause medicine hasn't taken a bigger place in our fields?
Yeah, I mean, I think part of it is just we didn't have much research in brain science and neurobiology until the pharmaceutical companies started contributing. So I think, since Valium and Prozac in the 60s, psychiatry is just heavily funded by pharmaceutical companies.
Hmm.
We just have to turn on the TV.
Yeah.
So I think that pharmaceutical drive that there is now a cure, or their word, they can't use the word cure. And then the insurance, the way our kind of managed care provides coverage for patients, it's much easier for an insurance company to cover a 10-minute med check than a 2-hour dietary history and evaluation. So I think those factors, plus the ease of, for doctors and patients, for the quick fix, medicine, I'm gonna be fine. And I think it's only, well, the tide, I think, is clearly turned, and patients are frustrated. And the good news is our doctors are getting frustrated as well.
Yeah, yeah, absolutely. And I do think that helping families to understand how they can do the functional medicine work, the integrative work, the dietary, those sort of things can be so rewarding and also so helpful for their kids. And I always talk with our families about just taking one step, just one thing. And I often try to figure out in that first visit what's the one hook, the one thing that may do the most to help this family get on board with doing the work and the hard work. And I think that a lot of them will, but I think all of your points are very well taken. Now, I know that you are working tirelessly to teach psychiatrists, mental health professionals, practitioners in general about, this root cause medicine. Do you want to talk about any of your courses and what you do to do that?
Sure. I mean, I think, being in the inpatient psychiatry world, seeing the really sick kids for so long, I thought the best way of making a difference was training doctors. So psychiatry redefined as an educational platform where we train nurse practitioners and general doctors and psychiatrists on this functional medicine. And we have, free webinars and courses, and then we have year-long training programs. And I realized that the doctors are going to take some time, and to make the dent that we need to in transforming this field. So then I started this consumer, for patients. So right now that's the Mind Refined, and the only courses we have up now is on ADHD. So it's kind of like finally focused parental course for ADHD and for parents with children of anorexia. So I think it's important that the consumers have changed, healthcare in the past, whether it was, you know, exercise and other wellness things. So I think my goal is to address, as you have, the parents who are the ones in the front line, as well as professionals.
Yeah, and often with the parents, they can take the information back to their caregiver if they're not even using it themselves. A lot on diet and nutrition and nutraceuticals in the Mind Refined platform.
Yeah, it's pretty much a kind of a much simplified kind of expression of this work, and steps where they can share with their doctor. I mean, some of it's very simple, like, can I get a vitamin D level, or have you checked my B12? And some of it you might need a practitioner who's more familiar with functional psychiatry.
Yeah. You mentioned B12. Do you want to expand on that anymore?
Yeah, well, I think my life changed last week when I saw an article that put the research into what I've been trying to say for 25 years. And I didn't make it up. Someone in our field said it to me. And the normal range for vitamin B12 is, each lab is different, but some are like 150 to 1100, some are 200 to 1100. And I heard once 25, 30 years ago that anything under 500 is low. And so that's how I practice medicine. And I can't tell you how gratifying it has been for me, although sad. Somebody has been depressed and fatigued, or a child. They go to their PCP, their B12 is 320, and they said, that's normal. It's not your B12. Go see a therapist. And I see them, I might give them one shot and they're a new kid, or they take sublingual B12. So yes, B12 is simple intervention. There's lots of paths to deficiency. I think every child who's struggling with anxiety and depression should have it checked, and it's easy to replete.
Yeah.
Anyways, the article that came out last week said, the research article, that levels, I think it was 500 and something. This was in adults, but higher incidence of cognitive decline and mental health symptoms.
Yeah.
So
Yeah.
it does exist.
Yeah, and there was also the converse of that is in kids with mitochondrial dysfunction and other issues. I've often seen very high B12 levels, and the doctor's like, "Well, that's we've got to do something about that." But what actually is going on is they're not getting it into the cell. They've got high extracellular B12, but even sometimes those kids, what will happen is if you have high MMA, your methylmalonic acid, your B12 within your cell or in the brain may actually be low. And there was an article on that not long ago looking at some of the blood-brain barrier antibodies and showing that the B12 levels with these very high serum levels actually had very low B12 levels in the CFS, in the cerebral spinal fluid. So I think both ends of the spectrum can be really something to look at.
Absolutely. I remember a study years ago that I still quote. I'm glad there's another one where they actually did spinal taps on adults that had normal B12 in the serum, but undetectable B12 in the CSF, the early cognitive decline.
Yeah. And then the other that we did some research on this summer was with folinic acid. And, Richard Fry and many others, Dr. Raymaker, Dr. Quadros, et cetera, have been looking at that for quite some time. It got more play this week, at least in social media, because I guess Dr. Fry was on some news program. But folinic acid is another one that we see can make a big difference in. I don't see so much cognitive decline as a pediatrician, but brain fog that we see, processing issues, irritability, tics, anxiety when they're not getting enough methylated folate into their brain.
And I've actually seen recently, based on listening to you, two positive frat tests in young adults with schizophrenia.
Yeah.
So that's something I haven't done for years, but I started doing it on adults with, and those have been incredibly rewarding as it was the only finding.
Yeah, we had a young man with schizophrenia who came in catatonic schizophrenia and actually got admitted to the hospital. Nothing was working. We had seen him before he got admitted and got the frat back, could not get the hospital to add it. He was sent home in very, very rough shape. We just started adding folinic acid, and he has now got a job doing amazingly, and really just folinic acid was what, I mean, he's on other medications, he's doing other things, but that was the game changer for him.
Yeah, I mean, another sad point of our reality is that too many times parents have read or educated themselves on some of these nutrients and they end up in a hospital and the doctors stop the supplements.
Yeah.
And that's happened in eating disorder residentials around the country, and that's just sad.
I get asked all the time, Jim, and I don't know if you know of any. Are there any programs now that allow that encourage that do that? Inpatient programs, I mean, that allow nutraceuticals, dietary, et cetera?
Well, funny you bring that up. So I just a week ago, I'm going to be working with a residential program in Texas.
Wow.
So that's a addiction and psych residential treatment program where we'll have a functional psychiatry program. So
Wow.
that'll be it's called Enter Health, ENTER, and they've been around for 18 years doing great addiction work and mental health work, but they want to integrate this and I'm going to help them. So
That's
started this
great.
week.
That's great. I noticed that there's not much room for sleep in your day with all you're doing.
Well,
Uh,
it's important to do the clinical work
yeah,
and great doctors there. So I'll be training them and, a program that's committed to this work. I can't, I know you get calls as well, but I get calls all the time. Where can I send my kid?
yeah,
And I don't have a lot of patients, places to send them because I know they're going to get 3, 4, 8 medications. Sometimes the programs will continue the supplements, but it's just challenging. So there are more programs. I don't know a great program for kids right now. This will be for 18 and over.
Well, I'm so glad you're doing it, and it is so needed, and we'll look out for that in the future. And also with your CME courses, the psychiatry redefined. I think one of the things that I've really enjoyed about that is not just the lectures and the Q&A sessions, but also, just being available to like office hours to answer clinicians' questions. And I think that whole model is a really good one for teaching practitioners that want to know more about root cause and functional medicine.
Yeah, I think one of the challenges that a few people have started talking about now is how to train, how to scale, and how to train more clinicians.
Yeah.
And it's hard to go to a conference. It's hard to just take a course and all of a sudden be, an expert in PANS PANDAS or a functional psychiatrist. And so it takes a tremendous commitment and it takes training. So we've just found that more hands-on office hours, communication has been kind of invaluable to help younger docs and nurse practitioners and clinicians learn the material.
Yeah. And if you could just let our listeners, viewers know where they find some of these things, how do they find out about this?
Sure, psychiatryredefined.org is the professional website, and there are courses for consumers as well. And then my website is James Greenblatt, MD.
That's great. Well, Jim, is there anything that you want to leave our listeners and viewers with? Any pearls of wisdom or any other takeaways?
I just, as I said, I've been doing it a long time, but the last, 5 years, the most important thing I can say is that parents should be hopeful, because I've seen psychotic kids from a state hospital completely turn around, and I've seen, whatever, trichotillomania, anorexia, so I've seen dramatic changes. And so I can only be hopeful and try to share that. I know it's easy to say and frustrating for parents, and certainly we don't have the answers for everyone, but I think a functional psychiatry approach just provides a path to looking at your child as an individual, and that I think should provide some hope.
Yeah. And I think that's so important. And it's not false hope. There really is hope with a lot of these interventions. So, Jim, I so appreciate you doing this and so appreciate all of your work. So thanks for being here, and I look forward to seeing you again soon.
Thanks, Nancy.
That's it for today's episode of Demystifying PANS PANDAS. I hope you're walking away with insights, tools, and hope to help you and your child on this journey. If you found today's conversation valuable, be sure to subscribe so you never miss an episode. Share this podcast with anyone who might need it. It could be the lifeline they're searching for. And if you have a moment, leaving a review helps us reach even more families who deserve answers. Also, for more information, training, and community, check out our website, drohara.com, and join our annual membership. And remember, every step forward, no matter how small, brings us closer to healing and understanding. Until next time, be present, be hopeful, and we look forward to seeing you next time on Demystifying PANS PANDAS.